The Food and Drug Administration recently approved a new nasal spray to help migraine sufferers. The agency found that it can treat symptoms within 15 minutes and can work for up to 2 days. So for perspective, nearly 40 million people here in the United States suffer from migraines, which trigger headaches that are so severe, the World Health Organization actually classifies migraines as the second leading cause of disability in the world. Local neurologist Dr. Ramon Bautista with UF Health Jacksonville is joining us now live via Zoom this morning to tell us more about this spray. Good morning. Thanks for being with us.
Good morning, Jen.
So what is this nasal spray and how does it work?
So yes, it's a very exciting time for migraine sufferers. It's a drug called sumatriptan given in intranasal formulation. So imagine this. You have a bad headache, you have a nasal spray in your purse, give yourself a spray, headaches are gone.
And is it for everyone? And what about any side effects?
Well, the side effects, that are typical for sumatriptan are things like, heart racing fast, maybe increased blood pressure. You need to talk to your doctor to make sure that it's the right drug for you. But for those who it actually is good for, it actually works quite well. And for those who have severe nausea after their migraines, it actually helps despite that situation.
And does it have to then be used at a certain time? And is there a limit on how much it can be used?
Well, of course, as a rule of thumb, take the medication at the very beginning of the headache. The earlier, the better. Even if you think you're just having a headache, taking the medication is going to help quite a bit. And sometimes, depending on what your doctor says, you might need to take it a few times during the day.
And I'm presuming this is covered by insurance then, so it's available for everyone?
Well, for the most part, I think so.
Are there any other newer treatments for migraine headaches that can prevent them? Because we're really talking about this nasal spray that if for migraine sufferers, they feel it coming on, they can take it. What about just trying to prevent them altogether?
Well, of course, it's an exciting time for migraine sufferers right now. There are actually treatment we can actually give them once a month. Imagine a once-a-month treatment that you can give yourself that can control your headaches. And of course, the old reliable Botox injections are there and physical therapy. So at the end of the day, you can actually now end up personalizing migraine sufferers to optimize your control of your headaches.
It's interesting because if there is an oral medication that can be taken once a month, as an example, why would people want the nasal spray? Why not just take the oral medication?
Well, it's actually a shot you give yourself, an injection you give yourself once a month. But the nasal spray is what you call an abortive medication. It actually stops the headache at the very beginning of the headache.
Very interesting. Doctor, thank you for joining us. We appreciate it.
You're welcome. Thanks very much.